You're listening to Soundside. I'm Libby Denkman. The federal government wants parents to do more breastfeeding. In a press conference last month, U.S. Health Secretary Robert F. Kennedy Jr. argued that infant formula falls short in comparison to breast milk.
All of the ingenuity of corporate America, all the resources, all the resourcefulness has not produced an infant formula that is superior in nutrition and all the qualities that we want to the infant formula that God made, which is the infant formula in a mother's breast.
And in a strategy report published last September called Make Our Children Healthy Again, I guess that's MOCA, the White House said it would work to increase breastfeeding rates. In some corners, these initiatives and comments have ruffled feathers, with critics arguing the emphasis was tantamount to shaming women who can't or choose not to breastfeed. But Kennedy's comments also got us thinking about the science behind the breast milk versus infant formula debate and why it stirs up so many emotions when people have been feeding their babies since, well, forever. Dr. Janelle Guirguis-Blake is a practicing family physician in Tacoma, and she's a clinical professor at the University of Washington School of Medicine. She has researched the effects of breastfeeding on infants. Dr. Guirguis-Blake, thank you very much for being here.
Happy to talk to you today, Libby.
So this topic of breastfeeding versus bottle feeding, it has become a little political, but it's also just so basic, right? How are you going to feed your baby? I'm curious for you to just start out by telling us, how does this topic show up in your work?
Sure. Well, happy to talk a little bit about both the science and sort of everyday clinical work where I take care of patients, I deliver babies, I then follow mothers and their infants for decades after they breastfeed or choose not to breastfeed. So I'm happy to sort of speak from both the clinical experience as well as a member of the scientific team that just finished this research project looking at the evidence for the benefits to infants and children from breastfeeding. So let me start a little bit with the evidence. So our research team, led by Carrie Patnode, looked at 29 systematic reviews and an additional 145 observational studies that have been published since the 1940s through last year. And that report is the most comprehensive report on the benefits of breastfeeding to infants and children that has been published to date. It was funded by the CDC. And the good news is we found and confirmed the strong association between breastfeeding and four specific childhood outcomes. So ear infections, asthma, obesity, and childhood leukemia. We also found an additional association with benefits, albeit more limited evidence, showing improvements in terms of respiratory infections, diarrheal infections, hay fever, inflammatory bowel disease, type 1 diabetes, cardiovascular disease, and infant mortality, including SIDS. So that's a lot of benefits to breastfeeding. And I'm happy to say that the evidence from observational studies over the last many decades does in fact support the health benefits to the infant of breastfeeding. There was also a recent review, also funded by the CDC, that showed that longer breastfeeding is associated with lower rates of breast cancer to women, ovarian cancer, hypertension, and diabetes. So these are major health risks to mothers as they age. And in fact, breastfeeding is associated with benefits in those outcomes as well.
Can I just ask, Doctor, just really quick, why would it be associated with these lower risks of cancer? Do we have any idea about the cause and effect there, or just the correlation?
Yeah, no, absolutely. There are some biological plausibilities to why you would expect reduced breast cancer and ovarian cancer. So really, both of those cancers are related to hormones and elevated hormones of progesterone and estrogen, which are changed by breastfeeding. So, for example, ovarian cancer, it's widely known that breastfeeding suppresses ovulation. So the ovaries aren't working as much and therefore less likely to have ovarian cancer in the long term.
Wow. Okay, so we have all this research that says, yes, breastfeeding is generally better for these outcomes in infants. What do we know about bottle feeding? Do we know anything about the effects if somebody, decides to or needs to go with infant formula instead? Do we know anything about the outcomes there?
Sure, that's a great question. This is really where I turn to more clinical experience, because, in fact, the studies that I described to you compare breastfeeding versus formula feeding. So what we're showing is decreased, for example, 30% reduction in ear infections. So it means there's a certain baseline risk in those that are formula fed, and it's reduced in those that are breastfed. So when I turn to my clinical experience, I really try to look at the evidence as a population average, right? So that's in large populations. But what's really important is an individual patient. So when someone is in front of me, for example, pregnant, I will talk to them throughout pregnancy about what their preferences are in terms of feeding. I also like to talk a lot about demystifying breastfeeding itself, also debunking some myths around breastfeeding, which we can talk about later, in order for the woman to make the decision that's right for her and for her family. I always say that a fed baby is a happy baby. And I think it's really important as a family doctor taking care of both the mother over long periods of time beyond pregnancy and delivery and taking care of her children that we look at the big picture, how breastfeeding or formula feeding works into their lives, both their family life at home and also work life.
What are the kinds of obstacles to breastfeeding? And I'm talking both physical, biologically, or in terms of economic or behavioral access, the realities of somebody's everyday life. What are the barriers for women that you treat or that who are your patients that you observe?
Yeah, absolutely. The most important challenges to breastfeeding, I would say, are to new moms. So those who've never breastfed before and those who haven't seen others breastfeed. So I do think that having peer support is very important. So during pregnancy, I will often talk to mothers about any family members or sisters or aunties who have breastfed. I talk a lot about what it means in terms of sleep. I think one of the challenges of breastfeeding is that moms feel like they have to be awake all the time or every 2 hours, 24/7. And that is incredibly challenging. So I'll say sleep deprivation is a major challenge to breastfeeding, or can be. And there are ways to work around that as well. I have had women pump for nighttime feeds for other family members to give those feeds. I know I did that with my children, so that I could get some sleep so I could go to work the next day. So work, that's another thing that's a challenge to breastfeeding. So paternity and maternity leave, those are limited for some jobs and certainly are in the United States. So thinking about going back to work can be really stressful for new parents. I do talk to mothers about the PUMP Act. So it's a federal act that requires most employers to cover breaks throughout the day for pumping in a clean and private space that is not a bathroom. So that's really important to set up ahead of time. So if moms know they're going back to work at 6 weeks or 12 weeks, they know they have a space and time that will be covered and paid for them to pump and give their babies breast milk. I think the other challenge is having patience. The expectations of how soon breast milk comes in, often it's 3 to 4 days for a new mom. And also dealing with challenges, as I said, it's a team sport. So for babies to get used to the suck and swallow, for moms to get used to positions, getting good positions in order to drain sort of both breasts, and then working in pumping, if that's something that mothers want to do, is sort of how to work that all in. Again, they're new skills, they're absolutely acquirable, but they require, I think, a lot of support that is available to many women.
I mentioned up top that there was some reaction to, especially RFK Jr., his press conference where he talked about the importance of breastfeeding and wanting to see more moms and more parents focus on breastfeeding. And what I saw from some advocates was this is going to shame people. This is going to, harm people who are unable to breastfeed, and then they maybe don't feed their babies formula and their babies go hungry, things like that. What do you make of those criticisms of this messaging from the federal government?
Sure. I think when I talk to patients, I make sure that all mothers know that the most important thing is to feed their infants and that I'm here to support them however way they want to feed their infants. Because again, I'm looking for a healthy mother and a healthy baby. There are some situations where mothers choose not to breastfeed. That is not for me to decide whether that is a reasonable choice or not. I do want to make sure that women know who want to breastfeed and think they can't. We do talk through that. So, for example, during the pregnancy, even preconception period, I talk about medications. Some women think that they cannot breastfeed if they're taking certain medications. So I work closely with our pharmacists to make sure that the medications preconception and during pregnancy either can be continued or we switch to other medications that are safe during pregnancy and lactation. So that's very important. So I want to make sure when women are making the choice, they're making the informed choice. I think the other thing that sometimes women think is if their breasts are small, they can't breastfeed, or if they've had breast surgery, they cannot breastfeed. That's not true. We can provide support for that with lactation specialists and experienced nurses to help with some breast issues. I think the other thing sometimes women think is if they have certain illnesses, they can't breastfeed. In fact, there are very few medical contraindications to breastfeeding, very rare, like active tuberculosis, which we rarely will see, or HIV with very high viral loads.
That
So
would
I
be
do
like the
make
only time you would say this is not a good
Absolutely
idea. Yeah.
not.
Hmm.
Active substance, illicit substance use is a contraindication. But again, we have MAT programs or medical programs with Suboxone, for example, and we have clinics in Tacoma that support women using Suboxone and methadone and also feeding their babies. So we have a lot of experience with that, and I want to make sure that during pregnancy and during the postpartum period, women are making the choices that are right for them.
I'm talking with Dr. Janelle Guirguis-Blake, who is a practicing family physician in Tacoma, and she's a clinical professor at the University of Washington School of Medicine, who has studied the effects of breastfeeding on infants. Are there any other common misconceptions about breastfeeding that you want to highlight for us, doctor? You mentioned something about, people with smaller breasts, they can, likely breastfeed, things like that. Any other common misconceptions?
I think a really common one is that formula-fed infants sleep better. There have actually been studies done showing that formula-fed infants don't sleep better than breastfed infants. I think that's a big one that families sort of talk about. I think the idea of formula and breastfeeding together, I think is a way to get both the benefits from breastfeeding and potentially if there are challenges to full-time or exclusive breastfeeding, formula feeding as well. We tend to support, again, whatever the mother chooses to do. The more breastfeeding, the better. And that's what we did show in the report that we did, is the more breastfeeding, the better. But there's no threshold. There's no percentage that seems to be better than others. It hasn't been studied. The other thing that people misconceptions are, if I start breastfeeding, I have to breastfeed for 6 or 12 months to get the benefits. Again, we didn't see that. What we saw was the more the better, but there's no threshold. So I encourage women to breastfeed, even if it's only for the first month or the first 3 months or the first 6 months. Whatever it is that they can do, I encourage them to do it.
What are some reasons that somebody absolutely couldn't breastfeed, and what are some solutions that they could pursue?
Sure. So I'd say what I commonly will see is very ill mothers. So they've had preeclampsia, perhaps with seizures or stroke. They're in the ICU. So they're actually not capable of breastfeeding because they are too ill to do so. And often those individuals have infants in the NICU who are premature infants. So I think that is a situation which we commonly encounter. where donor milk comes into play. So donor milk is milk that's provided by breastfeeding mothers who produce extra milk, and so they donate their milk to hospitals. That milk's carefully screened and pasteurized, and then given to NICU babies or premature infants in order to continue to feed them and to get the benefits of breast milk for those premature or very low birth weight infants.
The breast milk is pasteurized? Really?
It is.
Wow.
The milk that's given in hospitals. That is correct.
Huh. And so that is something, if there are health issues or something going on, I imagine like in an adoption situation, for example, that might also be another time when you would pursue donor milk.
Absolutely. About 80% of donor milk through hospitals are given to premature infants, but there are other situations, like you mentioned, adoption, where donor milk is an option. I do encourage mothers to look at donor milk that is appropriately screened and pasteurized. So if you go on social media, you will find there are private individuals who are donating their milk. I generally don't recommend those private sources because I can't vouch for their safety in terms of how the milk is screened or pasteurized. And certainly there are some infectious diseases one could transmit to infants theoretically through milk that's not screened properly.
Why do you think the issue of breastfeeding remains an emotionally charged issue? Again, it's as old as time as humanity itself. Why do you think it just stirs up so many strong emotions in people?
Yeah. I think there is nothing as vulnerable as an image of a newborn infant. And the responsibility of bringing an infant into this world and making sure that they are healthy and grow often falls upon the mother. And I think the people who make decisions around feeding should be the mother, and others often have opinions about how mothers should choose to feed their infants.
Are you a bad person if you choose to do formula feeding?
Absolutely not. Absolutely not. Again, I encourage women to feed their infants. That is the most important thing. And the proof is in the pudding. Those kids grow too. Again, we make choices every single day as parents for our children, and we're trying to do, I think every parent is trying to do the best for their child. And if they could breastfeed and it works with their families, then they choose to do so and are able to do so, then that's wonderful. And the most important thing is that we feed our babies.
Dr. Janelle Guirguis-Blake, practicing family physician in Tacoma, clinical professor at the University of Washington, and somebody who's done extensive research on the effects of breastfeeding for infants. Thank you very much. This has been eye-opening, and it helps a lot to sort of dispel some of the emotion around this issue. And also, there's always misinformation online or old wives' tales that we tell ourselves. So hearing from you has been really great. Thank you.
Thank you, Libby.
Thanks for listening to Soundside. Don't forget you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m. Monday through Thursday, or anytime online at KUOW.org or on your favorite podcast app.